breath we take, we dive deep into the game's core. Scrapes and victories in doctors' hands, from the sidelines straight to the score. Perfect pride in every breath we take, we dive deep into the game's core.
Welcome to the Halloween 2024 edition of the Starting Lineup Podcast. We're your hosts this week, Noah
and Isaac. In today's show, we'll discuss the history of sports in Halloween, Halloween traditions, emergency planning and procedures, and eating disorders.
But first, let's talk about something that is even scarier than Halloween, fentanyl abuse. This month of October has been designated as Fentanyl Poisoning Awareness Month by Governor Abbott.
Fentanyl is now the leading killer of Americans aged 18 through 45. In October of 2020, the state of Texas launched the One Pill Kills initiative to educate Texans on how to prevent, recognize, and reverse fentanyl poisoning.
Just 2 milligrams of fentanyl can represent a deadly dose. So far in 2024, law enforcement has seized over 47 million pounds of fentanyl pills and almost 6,000 pounds of fentanyl powder. That is over 292 million deadly doses.
Fentanyl poisoning can be reversed with naloxone, also known as Narcan. Naloxone is a medicine that rapidly reverses an opioid overdose. It is an antagonist. This means that it attaches to opioid receptors and reverses and blocks the effects of other opioids. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose.
Fentanyl is deadly to even one pill can kill you or someone you love. Many pills like anxiety meds or narcotic pills, painkillers are being faked and laced with fentanyl. The best way to prevent fentanyl poisoning is not to take any pill that doesn't come from a doctor or parent. For more information, check out Deal Government One Pill.
Halloween is a holiday celebrated each year on the 31st of October. The tradition originated when the ancient Celtic festival of Samhain over 2,000 years ago. Over time, Halloween evolved into a day of activities.
Some popular Halloween traditions are carving jack-o'-lanterns, trick-or-treating, bobbing for apples, costumes, bonfires, and candy corn. Halloween traditions are different all around the world.
Over the years, a lot of sports teams have embraced Halloween by hosting themed games around the holiday. Many athletes enjoy celebrating Halloween, sometimes dressing up in costumes for practice or even team events. Some sports events have taken place on Halloween, like the World Series in baseball, has had games that fall on October 31st. On Halloween afternoon in 2004, the longest winning streak to this day in NFL history came to an end, dating back to the previous season. Tom Brady led the Patriots off to a 21 consecutive win.
What is an emergency action plan? An emergency action plan, also known as an EAP, is proper planning essential to ensure appropriate initial first aid injuries. It allows all staff to have a calm and steady plan instead of being unsure and scared about what to do. An EAP allows others to know who does what, who specifies qualifications, and who is trained to use the AED, CPR, and the first aid.
Why is it essential to have an EAP? An emergency action plan EAP is essential for athletes because it helps ensure that athletes receive appropriate care in a timely manner and reduces the risk of legal actions. Emergency action planning is an important preventative measure for high schools to take to protect their athletes from sports-related injuries and illness.
What are the components of an EAP? The components of an EAP are the responsibilities and the roles of certain people, where AEDs are located, where first aid kits are located, and how the area is mapped out. People who are part of the EAP must be trained to know what to do during an emergency. A contact list must be made in case anyone is needed to be contacted during an emergency. Some contacts can include head trainers, EMS providers, athletic coaches, and medical regions in the area.
What is the pregame medical timeout? The pre-game medical timeout is a meeting held before a sporting event to review safety procedures and emergency response plans. It involves medical staff, coaches, and officials to ensure everyone is aware of their roles in case of an injury or other medical emergencies. This helps minimize confusion and maximize the effectiveness or care during an emergency.
Anorexia nervosa is an eating disorder that restricts nutrient intake, which leads to significantly low body weight. People may also have an irrational fear of gaining weight as well. Anorexia nervosa has the second highest death rate of any mental illness. Bulimia is when a person overeats, or what they call binge eating. Then right after they overeat a lot of food in one sitting, they do what they call purging, and what this is basically they vomit or use laxatives inappropriately.
Avoidant restrictive food intake disorder is a condition that causes you to limit the amount of type of food that you eat. Signs and symptoms of this disease can be severe weight loss, lack of appetite, slow heart rate, or low iron or thyroid levels.
People with binge eating disorders probably regularly eat more than most people. When stressed or upset, they often eat quicker. Even if they are feeling uncomfortably full, they can't stop eating and they will just keep going. Joey Jules from Penn State had a binge eating disorder. That's why he left Penn State in the spring to get help. But Joey was a fan favorite for his abilities on the field as a kicker.
Pica is an eating disorder in which a person eats things not usually considered food. This is typically found in small children who put things like toys or grass in their mouths because they are curious about the world around them. This can lead to low iron, constipation, lead poisoning, small and large intestine blockage, and roundworm infection.
Female athlete triad, or REDS, is an interrelated condition that often affects physically active females due to inadequate energy levels. Female athlete triad consists of low energy levels due to eating disorders. Sooner than later, this leads to a decreased bone density, most commonly known as osteoporosis.